Hi, Kent Bottles here, from my video studios on the main line of Philadelphia. This is the first in a series of videos to explore the transformation of American medicine in the 21st century. Today, why does it cost so much? Why do we get so little out of it? I'll start with a quote from Upton Sinclair. "It is difficult to get a man to understand something when his salary depends upon him not understanding it." So, what do leaders do? You're a leader. I'm a leader. What do? We only do four things. First, establish a vision that can inspire yourself and the others that work with you. Second, translate that vision into strategies and tactics. 3, assign those strategies and tactics to people that work for you. And 4, hold those people accountable for outcomes. Remember, if you want to summarize the entire atmosphere of American medicine today, it's 4 words. No outcome, no income. So, the disquieting truth about American healthcare today is we spend too much money on it and we don't get quality healthcare back for it. We spend about $2.5 trillion a year on healthcare today in the United States. Without controlling this expenditures on healthcare, the federal budget deficit will continue to balloon and American companies will continue to flounder in the world economy. The U.S. spends 2.5 times per person what counterparts in Europe spend. So what I conclude from this is we spend too much money on healthcare and we don't get high quality healthcare in return. Ezekiel Emanuel had a slide that really shook me up. He showed a slide talking about how big a trillion is. 1 million seconds ago is less than 2 weeks ago. 1 billion seconds ago is 1974. 1 trillion seconds ago is 30,000 BC. Spending $2.5 trillion on healthcare, that's a really big number. We've got to control it, and we can. So why do we spend so much money on healthcare? I think the main solution to that, the main answer to that, is in the Dartmouth studies. For over 30 years, they've tracked healthcare spending in America, mostly using Medicare data. Medicare spending varies almost threefold among the 306 hospital referral regions. For example, in 2005, in Rapid City, South Dakota, we spent $5,281 for each Medicare beneficiary. In the same year, in Miami, Florida, we spent $14,359 per Medicare beneficiary. Big difference. Another way to look at this variation in inpatient care intensity during the last 2 years of life for Medicare patients. In Newark, New Jersey, the average Medicare patient in the last 2 years of his or her life spends 35 days in the hospital. A similar study for Salt Lake City or Portland, Oregon shows they only spend 12 days in the hospital. That difference between 35 days in the hospital in the last 2 years of life and 12 days in the hospital really could create the savings needed to save Medicare and put the American budget back on track. One more way to look at this is to compare UCLA, which is a high-intensity, very excellent healthcare system, but that doesn't really do a great job of managing care, and the Mayo Clinic, another high reputation healthcare in Rochester, Minnesota. Spending the last 2 years of life at UCLA, $93,842. Spending the last 2 years of life Mayo Clinic, $53,432. So, if we could figure out ways to get UCLA to treat patients the way they do in the Mayo Clinic, we would save $700 billion a year. In our next video, we'll explore, why does it matter? Isn't healthcare really important? It's probably okay if we spend too much money, don't you think? Tune in again. This is Kent Bottles from Mainline Philadelphia with another in The Future of Healthcare, Why It Matters to You.